Hi, I'm Liz Verhelle. I'm an occupational therapist.
I'm Neal Church. I'm a physical therapist.
Welcome to Across the Table Elbow Edition.
We're going to talk about elbow fractures today. Liz, whenever people come in here with an elbow fracture, are they coming in after a surgery or are they coming in after being immobilized?
Both. It depends on the type of fracture. Sometimes fractures are simple fractures and they're called hairline fractures and they don't require surgery. And then other times, if it's a more complex fracture that does require surgery, it's called an open reduction internal fixation, or ORIF. One of the surgeons I work with at Annapolis Hand Center is Dr. Tom Dennis.
The elbow is very susceptible to injury in both children and adults, and they can dislocate, they can fracture, and it's made up of three bones: the humerus, the radius, and the ulna. And any of those bones or a combination of those bones can break. Now, most of the time when those fractures happen in children, they tend to be falling off the monkey bars, jungle gyms, skateboarding, and then they have these fractures that many times need to be fixed with what's called an open reduction internal fixation, where we actually do a surgical procedure under general anesthetic, and the child is put to sleep, and then the bones are put back together and held in position with small wires or sometimes screws. Now, in the adult population, they can be a little bit more problematic, even in a non-displaced fracture like a fracture of the radial head, or an olecranon fracture, which almost always needs to be fixed. The ones of the distal humerus, which is the big bone, if they're displaced, will need to be fixed with multiple plates and screws. The major problem with those, and the problems we have, are that many of those elbows will get stiff. The elbow joint gets stiff faster than any joint in the body. So it really needs a recruitment and help from our hand therapist and OT. Adjunctive therapy, in addition to the OT, sometimes we use dynamic or static type braces, like Dynasplints and things that will help with their movement, that they'll use for months sometimes at a time, or even for shorter periods.
So someone comes in after an elbow fracture. What are their challenges?
Well, that's a really good question. As everybody knows, the elbow is responsible for bending, straightening, and then also turning this way. So you can imagine that after being immobilized or even having surgery, the elbow gets very stiff. So eating, makeup, shaving, washing your body, driving, turning keys, pulling open a door, all of these things are affected.
Wow, so a lot of work to be done. Now, are people able to start right into their therapy right after their surgery, or do they have to wait a while?
It depends on the surgery, it depends on the surgeon, and it depends on the severity of the involvement.
Okay, so they come to you as you're an occupational therapist. What happens the first day when they come in?
Well, I'll do an initial evaluation. I want to get to know the person. I want to know what their challenges are, what type of surgery they had, what they can and cannot do, what their range of motion is, and what their limitations are.
Okay, so you figure that out, and then what's the plan for the patient?
Home exercises. I always give homework. So depending on, again, on the person, the severity, and what they're allowed to do, because most of the time the surgeon will send them with a protocol of this is what I did and this is what they can do.
Okay.
So then we'll start on sometimes it's just moving the hand at first and wrist, and doing range of motion exercises of the hand and shoulder, not moving the elbow right away. Sometimes we're allowed to start moving the elbow right away.
Okay.
Sometimes it's managing the swelling, because swelling is always an issue with elbows. Sometimes it's managing the scar. So it really just depends on the person and the injury.
And then some people have this perception that if they get a surgery on the elbow, it's going to take a lot longer than if they were just immobilized.
Not always, not always. Again, it's very individual. Some people come out of surgery and they have no stiffness. Some people are very stiff and very guarded and protected of their elbow. Some people who don't need surgery are even more guarded and are even more stiff than if they had surgery. So again, it's very individual. It depends on the injury, and it depends on how bad it was and how long they're immobilized.
Okay. Now, tell me about the home exercise program that you give them.
I typically only will give 3 exercises at a time, because I want to make sure the person's going to be able to do it. If I gave 20 exercises, would you do it? No, probably not.
Right.
So I give usually 3 exercises, something that they can do sometimes every hour.
I know that as therapists we have to do more with less nowadays. So utilizing the time outside the clinic has become more and more important. How do you do that?
I use a Dynasplint to do progressive gentle stretching at night. During therapy, the goal is to get as much stretch as possible, to get as much increased range of motion as possible, and then when the person goes home, I don't want them to then stiffen back up again. So depending on the limitation, I might put them in a splint that will assist with flexion, and sometimes I'll put them in a splint that would assist with extension or the supination.
Okay.
And that really just complements the therapy that I'm doing, and it helps that person continue to gain motion.
Okay. So Liz, as the weather's warming up, are you seeing more sports injuries?
Absolutely. This is always a busy time of year for athletes.
Now, are athletes qualified, or are they good patients for splinting as well?
Absolutely. They're highly motivated to get back to the sport that they were enjoying, whether it's because they're going to be a college athlete or because their team needs them or they're about to go into the final games. So the biggest thing with any injury is compliance. You need to do what the therapist tells you. You need to wear the splint. You need to do your exercises at home, because some people can't come in 3 times a week for financial reasons or their visit limitations. They need to maximize their time in and out of therapy. Elbows are important. We need to be able to feed ourselves. We need to be able to drive and do our hair and put earrings in and all those simple things that you don't think about. So with an elbow injury especially, because elbows like to stiffen up, it's extremely important to do your home exercise program, to wear the splints if prescribed.